In this tutorial, we will discuss the blood supply of the hand and wrist. The hand has an extensive arterial supply with many anastomosis between vessels, allowing the hand to be highly perfused when under high resistance overflow, such as while grasping or making a tight fist. So let us begin with the arteries. I will change the scene color to get a better view. The blood supply of the hand is mainly provided by the superficial and deep palmar arches, which are interconnected vascular arches formed by the radial and ulnar arteries. Generally, the thumb and the lateral side of the index finger are supplied by the radial artery, while the medial 3 digits and the ulnar side of the index finger are supplied by the ulnar artery. Now we move on to more details regarding the origin, course, branches, and supply for each of these arches. The ulnar artery enters the palm superficial to the flexor retinaculum and lies between the flexor retinaculum and palmaris brevis. It then swings laterally, crossing the palm and forming the superficial palmar arch. The superficial palmar arch lies deep to the palmar aponeurosis and superficial to the long flexor tendons. On the radial side of the palm, it anastomoses with the superficial palmar branch of the radial artery. The superficial palmar arch gives off 4 branches that emerge from its distal convexity. These are 1 palmar digital artery to the ulnar side of the little finger and 3 large common palmar digital arteries that supply the medial side of the index finger, both sides of the middle and ring fingers, and the radial side of the little finger. Each receives the corresponding palmar metacarpal artery from the deep palmar arch before dividing into 2 proper palmar digital arteries that enter the fingers. The proper palmar digital arteries from each pair run along the adjacent sides of the index, middle, and ring fingers. Let me hide the distal phalanges to see their termination. The proper palmar digital arteries give off terminal branches at the tips of the digits and anastomose with the same branches of their adjacent counterparts. These anastomoses include the superficial arterial arcade and the proximal and distal subungual arcades that supply the distal elements of the index, middle, and ring fingers. Moving on to the radial artery. The radial artery leaves the dorsum of the hand by passing over the floor of the anatomical snuff box and then turning forward between the first and second metacarpal bones. Next, it passes between the 2 heads of the first dorsal interosseous muscle and then between the oblique and transverse heads of adductor pollicis longus, to finally become and continue as the deep palmar arch. I switched the view to reveal the branches of the radial artery in the dorsum of the hand. Before penetrating the back of the hand, the radial artery issues 2 branches, which are the first dorsal metacarpal artery that supplies the adjacent sides of the index and thumb, and a small dorsal carpal branch that arises beneath the long extensor tendons of the thumb. It crosses the wrist medially and anastomoses with the dorsal carpal branch of the ulnar artery to form the dorsal carpal arch or the dorsal carpal network. The dorsal carpal arch gives rise to 3 dorsal metacarpal arteries that run distally on the second, third, and fourth dorsal interosseous muscles and divide to become small dorsal digital arteries that enter the fingers. 2 branches, the princeps pollicis artery or the principal artery of the thumb, and the radialis indicis artery, arise from the radial artery just as it turns medially towards the deep part of the hand. The arteria princeps pollicis is the major blood supply to the thumb, and the radialis indicis artery supplies the radial side of the index finger. Moving again to the palmar surface of the hand. The deep palmar arch is a direct continuation of the radial artery and is completed medially by the ulnar artery via its deep branch. It passes between the metacarpal bones and the longer flexor tendons. The deep palmar arch is mainly responsible for the blood supply of the carpal and metacarpal bones, as well as the joints and the small deep muscles of the hand. The deep palmar arch gives rise to 3 palmar metacarpal arteries that run distally and anastomose with the common palmar digital arteries of the superficial palmar arch, and also to 3 perforating branches that pass posteriorly in the second to fourth interosseous spaces, and anastomose with the dorsal metacarpal arteries that emerge from the dorsal carpal arch. The superficial and deep palmar arterial arches are accompanied by superficial and deep palmar venous arches. The deep palmar venous arch receives the veins that correspond to the branches of the arterial arch, which include the palmar metacarpal veins. The superficial palmar venous arch receives the veins corresponding to the branches of the arterial arch, which are the common palmar digital veins. The superficial veins of the hand drain into the dorsal venous network that gives rise to veins such as the basilic vein and the cephalic vein. The cephalic vein arises from the lateral side of the dorsal venous arch, while the basilic vein arises from the medial side and then passes into the medial aspect of the forearm.